We're extremely pleased to be joined on this edition of Talking Preps by Dr. Erin Reynolds, who is the Director of Sports Concussion, the Sports Concussion Program for Baylor Scott White at the Star. And Dr. Reynolds, thank you so much for joining us today.
Thank you so much for the invitation.
Oh, my pleasure. First off, how's the COVID impacted your job and your role and what you all do there at BSW?
Yeah, so I, as you said, I'm the director of the Sports Concussion Program at Baylor Scott and White at the Star in Frisco, Texas. So we're on the campus of the Dallas Cowboys. It's a big sports medicine facility. And kind of two things happened simultaneously. One is COVID-19 hit, and we had to immediately figure out how to shift our entire clinic from in-person to virtual. We did that. It took a few days, but we got there. And as we continued to treat our patients, the other thing that happened is everyone stopped playing sports. So there was this natural shift in our focus in terms of patients, because for a little while there wasn't anyone getting hurt. So as a program, we really shifted. And the last few months, we've just focused on getting our research out and doing program development. And now I'm actually not sure what's happening up where you are, but where I am, the kids went back to camp this week. So at our Texas high schools, the kids are back doing strength and conditioning, and we're starting to get more active. So as that happens, we're getting back in the clinic and seeing more patients. But as you can see, I'm in my home office today. So I'm taking advantage of this time that I have to do these other projects that I don't typically have a time to do during the school year.
Yeah. So what people may not realize that, a sports concussion program is there. What is the role of the program, and how do you interact with the athletes?
So our program, just to give you a little bit of background on myself. So I call myself a sports neuropsychologist. So I went to grad school for clinical psychology, got my doctorate. I then specialized in clinical neuropsychology, which is the study of brain behavior relationships. And I did that with the VA hospital, working with veterans. And then I super specialized in sports concussion at the University of Pittsburgh Medical Center Sports Concussion Program. So for any coaches or athletic trainers listening, that is the institution that developed the IMPACT test, which is a very widely used cognitive test for concussion. And I was there as faculty and their fellowship director for about 5 years when this opportunity in Frisco arose. And the idea was to bring this program, which is actually the largest clinical and research program in the country up in Pittsburgh, here to Frisco, Texas. So at first it was just me. And if you can imagine, it was just me kind of working in this small office off to the side of a PT clinic. That was in 2017. And since then, we have grown the program to now include myself, a full-time sports medicine physician, a vestibular therapist, which I can tell you a little bit more about what she does if you're interested in hearing. We have athletic trainers, we have full staff, and we're able to serve the local population. And now with telemedicine, we're able to expand that a little bit further. We can't cross state lines yet, but hopefully that'll be in the near future that we can cross into Arkansas. So what we do is we serve the community. I would say the bread and butter of what I do is working with middle school and high school athletes who have sustained a sports-related concussion. We also work with the professional teams in the area, colleges, anyone who sustains a sports or recreational concussion, so the weekend warriors, if you're in your 50s and you hit your head playing tennis, we'll see you. We put them through a comprehensive program. So I can tell you a little bit about that if you want.
Sure.
I don't want to just assume you want to hear about it. Okay. So our program, like I said, it's multidisciplinary. I truly believe that concussion is an injury that you can't treat in isolation. So I know that a big problem in our country is that there are these rural pockets that don't have what we have in Frisco. And we're trying to help those areas out. But the beauty of what we do is we all come together. So we have sports medicine and neuropsychology and physical therapy, all treating the same patient. And so we're all looking at this patient through different lenses, putting our knowledge together and developing these individualized treatment plans. So when that happens, we're able to keep these kids really active. They miss very little school. Typically, it's only a day or two at most. And we're getting them back into normal activity as quickly as possible so that, A, they feel better, and B, the recovery times are shorter when we're able to work together and push them through.
So it's changed. Treatment now is to get them active, where it used to be, you try to isolate and go to dark areas and so. So we're totally away from that, and now is that perhaps the biggest breakthrough we've seen in the concussion studies and everything?
Yeah, so when I started doing just concussion, it was 2012. So I'm 8 years in, and the tide was really turning then. But the problem is the tide turns in these, like I said, these small geographic pockets. So there's a few places throughout the country that are really progressive with this, but then most of the country is still behind, and it's just because this field moves so quickly that unless you're someone like me who only does concussion, focuses on this night and day, you're probably not going to be able to keep up with the literature and be able to move your practice as quickly as someone who is super focused. And so what happens is in a lot of these rural areas, you'll have, a pediatrician or a few pediatricians or a few sports med docs that have to take care of everything in the community, every sports medicine injury. So then you have the same doctor treating your knee that's treating your brain. And there's some, I don't know, cons to that, I would say.
Mm-hmm.
So yeah, I mean, what I find is I still get referrals sometimes from outside the area where these kids are being told just shut it down. And I think that that's really it's about liability. It's about not wanting to make someone feel bad when they're injured. So what we've learned with concussion is that in order to get better, you have to feel those symptoms. You can't just isolate. And when you put yourself in the dark room and you pull the shades and you avoid technology and you just cocoon yourself, that starts to affect your mental health. And athletes are just primed to want to be part of the team and be active. So that is actually counterproductive. We're taking a piece of who they are away when we do that, and that creates a lot of other problems. So we've changed completely over the last decade. I mean, we're really now, as a field, all moving towards this idea of active recovery. Some folks are more aggressive with it than others, but we pretty much all agree now that the dark rooms have to stay in the past because they just don't help.
You mentioned middle schools. Concussion, I mean, people think concussion, normally they think, the pro athletes, some high school athletes, but I mean, everybody is susceptible to this. How often do we see it go unnoticed, maybe in the middle school kids, because the resources aren't there?
Yeah, I think that the middle schools are an area that is just ripe for, having some focus on it. So here, at least, I live in an area where the school districts have the resources to have athletic trainers in the school. We know that is not the same across the country. Here in Frisco, the high school athletic trainers help with the middle school. So we have some level of communication with the middle school coordinators to identify concussion, but it comes down to education. Educating the coaches, educating the parents, and having an action plan for those middle school kids. And a lot of times we're not thinking about that at middle school because the resources aren't there.
Mm-hmm.
My husband and I are youth soccer coaches. So, right now my son is 6, so we're U7 soccer coaches. And there's some concussion policy in the league that we're a part of. But the reality is kids that age, so now we're not even talking about middle school, we're talking about elementary school, they're hitting their heads so much. I mean, my son is constantly hitting his head. But I think that age group, the youth market, the elementary school kids, I think those are the ones that we're really not paying enough attention to. And that we really need to start focusing on how do we start planting the seeds with them to educate them, so we don't wait till they get to high school and they think they know everything, and then we try to give them all this new information about concussion.
Yeah, and also speaking about concussions, everybody, football's the first sport that obviously comes to mind, but it's not the only sport in which concussions can happen. Do we sometimes overlook that fact and think, oh, well, it's not football, there's not a concussion probability in that sport?
Yeah, I mean, the focus is and has been for a long time on football. Even when I was in Pittsburgh, Western PA is a hotspot for producing NFL players, and there's a football mentality here, probably not quite as much as there is in Texas. But the reality is, at the end of a year, if I look at all of my patients that I've seen and the different sports they've played, football makes up a subset.
Hmm.
And the interesting thing about football is it's really not played year round. I know that's questionable because we have spring ball and other things. But if you look at a sport like soccer, they are playing year round. They're conditioning year round. Volleyball. When I moved to Texas, I was shocked at how many club volleyball players I was seeing because it's very big here. So some of these sports that practice year round, they have higher rates that we're seeing in the clinic because they're just always pushing it and always playing. Whereas football, there's some inherent injuries that are going to happen. But I also think that the messaging around concussion has been so focused on football that there is a new level of understanding there, both with coaches and with players, that maybe is not happening in, high school girls soccer or other sports.
What signs do coaches and parents maybe need to look for? Because sometimes it's not obvious when someone has had a concussion. So what is something coaches and parents can do to be look for that, or maybe to help prevent a concussion from happening, if that's even possible?
Yeah, so little shameless plug here. If they
Okay.
go to our Baylor Scott and White website, there's a video on that would be it. There's a video on there that I actually created for the UIL in Texas, so the Interscholastic League in Texas, and it walks through all of those things. But I also recommend, here we hand out little pocket guides that have some things to look at for parents. There are some very overt things that parents will not miss if it happens. So someone gets hit in the head and they pass out, someone is vomiting, they're stumbling around on the field. Those are things that they're not going to miss. But there are other more subtle things that could happen. And so, a lot of times the parents aren't going to see this right away. So this is why education is so important, because if your son comes off the field, he's been hit playing football, he sits down on the bench and he's dazed and he's confused, the kid sitting next to him might be the only person who knows that. And so we need that teammate to feel comfortable saying, hey, there's something wrong here. Sometimes they're not going to seem different at all when it happens. And I talk to parents sometimes where they say, he took a hit, he seemed fine. After the game, he seemed fine. And then later that night, everything set in, or the next day, I realized something was wrong. So every single injury is going to be different. And I think as a parent, you really have to know your kid. And so I don't think you should, sometimes I'll hear parents say, they ask for a Tylenol after the game, but they often ask for Tylenol after the game. Or, she's always complaining of a headache, so I didn't know. I think that we just have to be cognizant that sometimes it might not just be another headache. And we really just have to ask those questions and make sure we're not missing something that happened. And sometimes a headache's just a headache, right? So sometimes it's not a big deal at all, but just really communicating with the athlete and understanding what has happened and how they're feeling.
How soon would symptoms show up on average, and how long do they last after a concussion?
So usually you're going to know right away. I mean, the most common symptom is headache. And so typically headaches start. We also always look for on-field dizziness. Typically when I see the kids a couple days later and I ask what their experience was on the field right after the hit or on the court, something changed. But that's not always the case. And sometimes it's very subtle. It's like I felt dizzy for a second and then I felt fine and I played the whole game and I got a headache afterwards. But most of the time they're going to know something has happened. A small subset, like I said, it'll be afterwards, maybe later that day or even a couple days later. So the time to recovery is an interesting question. We've been studying that for a really long time. And we used to say, concussions resolve within 7 to 10 days, and then they can start their process back to play. But we know now that teenagers, on average, can take up to about 21 days. We're looking at about 3 weeks from time of injury to time of recovery. And the younger kids are taking even longer. They're taking about, on average, 30 days. And so that includes the criteria, let me just define that. So when I say return to play, this international consensus criteria that we agree on is that they are symptom-free at rest. So that means that they're able to get through their full day of school without having any symptoms. They're symptom-free with exercise, which means we're putting them in most cases through a 5-day return to play protocol, which is just increasing their level of physical activity every day. And then we're looking at their cognitive performance, whether through computer-based neurocognitive testing or through some paper measures that are taken pre-season. But we're making sure that their cognitive functioning is where they were before the injury, or we can estimate where it should have been before the injury. So those are the 3 things we really focus on for clearance.
Well, that's fascinating. I did not realize, and I'm sure a lot of people listening did not realize, that the symptoms can last that long. So
where we've gone in the last 5 years or so is to stop thinking about concussion as this homogenous injury, right? So back when I were in high school, you got a concussion, and what happened? You smelled something, or how many fingers, and we didn't understand it back then. And a concussion was a concussion, and you got over it. And now we understand that there are actually different subtypes or profiles of concussion. So there's 5 clinical profiles that you can discern. So it sounds more complicated than it is, right? When these kids come in to see me, my job is to find out, how do they feel, why are they feeling that way, and how are we going to fix it? And so I look for these different profiles. Some people fall into this vestibular profile. So the vestibular profile includes dizziness, motion sickness, problems with balance, things like that. Other kids are going to fall into a migraine profile, where they're having post-traumatic migraine headaches. Others will fall into an ocular profile, where they're having problems moving their eyes. They can also have problems with sleep. The trick here is that most people are not going to walk in and fall into one specific profile. They're going to be overlapping, and they're going to be interchanging. One symptom in this category is going to negatively impact a symptom in this category. So we need to map out, what profiles are we seeing, what underlying factors are affecting those profiles. So things like sleep, dysregulated sleep, any kind of cervical pain, neck involvement. And then we have to prescribe very specific treatment plans so that we are treating the right things in the right order.
Fascinating. And of course, there's a lot of information on your website as well, Dr. Erin Reynolds, on Twitter, and lots of information there. Oh, this is just a fascinating topic to me, because we've come what we knew back then in the dark ages with the dinosaurs compared to what we know now. It's just night and day what we know. It's amazing, and there's a lot more to it than we knew. Do you see further breakthroughs coming? I mean,
oh yeah. So I think, first of all, we like I said, in these last few months, we've really focused on our research. So I'm actually partnering with my former colleague from the University of Pittsburgh, who is now at the University of Arkansas. So Dr. RJ Elbin runs the Arkansas Sports Concussion Lab on the campus in Fayetteville. And so right now we're working on looking at, how can we improve outcomes? How can we improve access to treatment? And what factors play a role in delaying these recoveries? So there's things like that we're looking at. And then on a different level, there are folks out there looking at biomarkers. I really think that at some point in my career, we're going to be able to do a cheek swab or a blood test on the sideline and know what's happening. We're not there yet, but there's a lot of folks looking at it. There's a lot of really smart people trying to figure these things out, how we can use imaging and different things. So yeah, I think we've come a long way, and I think we're going to continue to go a long way in the next 5 to 10 years.
Fascinating. Is there, if there's one takeaway for parents and coaches and even athletes who need to be aware of this, because it is their body, that they need to take away when it comes to concussion, what would that be?
Okay, can I give you 3 quick ones?
Sure, 3 will work.
Because I like to give these 3. I give them all the time. Number 1 is concussion is a treatable injury. It is nothing to be afraid of. You have to take it seriously, but it is completely treatable. Number two is that in order to have concussion be this treatable injury, you have to have active recovery. So those dark rooms are out the window. So concussion is treatable, active recovery is key. And the third thing, which isn't specific to concussion, but I always emphasize when I talk to parent groups and athletes, the benefit of team sports far outweighs the risk, particularly in concussion. So we could talk for another 2 hours about the psychological benefit of team sports and how we are teaching these young men and women to grow as humans through team sports. I don't want anyone to be afraid and have fear of concussion, hold them back from allowing their son or daughter to play team sports. So my 3 takeaways: concussion is treatable, active recovery is key, and the benefits of sport far outweigh the risk.
Excellent. Well, this has been a fascinating conversation. I don't want to keep it any longer than possible, but do you have time to play our quick quiz real quick?
Yeah, let's do it.
All right, here we go. First place you will take your family is to get a haircut or out to eat.
Oh, haircut.
Do you play a musical instrument?
I don't play a musical instrument. Maybe I should have picked that up during quarantine.
Well, it sounded like you were busy, though, so we'll let that slide. More likely to be in your playlist, country or rock?
Oh, gosh. That's a hard one because it would be rock, but then Johnny Cash is like, I mean, you put that up, but probably rock.
Okay. Well, you could do both. We'll let that.
I'm from New York,
happen.
don't forget. I'm not from Texas.
Okay. Last movie you saw at a theater?
Oh my gosh. I can't remember. It was definitely a kids movie. Oh, I can remember. It was Incredibles 2, and we didn't make it through the whole thing because my son was done.
Oh, man. And finally, have you spent more time cleaning the garage or doing yard work at your home?
Doing yard work, for sure.
Yeah. I think that's by far the most popular answer. And again, if you want to learn more, drerinreynolds.com. A lot of great information there. Of course, the Baylor Scott White website as well. She's also on Twitter. So really, this is a very serious topic that probably does not get enough attention that it should when it comes to sports. But thank you so much for the work you're doing. I know it's making an impact, not only in Texas, but hopefully with telemedicine and they loosen those laws up, can make an impact everywhere, because this is something that really does need to be available to all athletes, does it not?
Absolutely. Yeah. Thanks so much. I'm always happy to spread the news and the education as far and wide as I can. So, and I'm a fan of Arkansas for obvious reasons. Oh, maybe not. Did I mention my daughter goes to Arkansas?
That's good. That's good. We like that. All right. Well, thank you so much.
All right. Thank you, Blair.
All right. Have a great day.
You too.